Let's just say it straight. Most guys are out here searching for the G-spot like it's buried treasure, and 90% of them never actually find it. They jab, they poke, they change positions like they're cracking a safe, and then wonder why she looks politely unimpressed. So today, we're cutting the mystery. You're going to understand what it really is, where it lives, and how to identify it like an adult who actually knows what's going on inside a woman's body. First, I'm Nora Vale, men's health and sexuality educator. I've spent over a decade teaching anatomy to both doctors and regular guys who just want to be better at this stuff. And I promise you this: finding the G-spot is not magic. It's anatomy plus patience. What separates good lovers from confused ones is attention, not ego. Here's what we'll break down. 1. The real structure and location of the G-spot. 2. What conditions make it noticeable? 3. How to recognize it by feel. 4. What to do once you find it. And finally, the single mistake that makes most men miss it, even when they're literally touching it. So, let's start with the basics. The G-spot is not a button. It's a zone, technically a section of tissue called the urethral sponge. It sits along the front wall of the vagina, between the vaginal canal and the urethra. It's not a separate organ. It's part of the same network that connects to the clitoris internally. Same nerves, same blood supply. When it's aroused, it swells and becomes firm, which is why it suddenly feels like a ridge or pad under your fingers. If you were to trace it, it starts about 2 to 3 centimeters inside, running upward toward the pubic bone. Think of it like the underside of a small arc. At rest, it feels flat and smooth, like the inside of your cheek. Once arousal kicks in and blood fills the tissue, it thickens and takes on a slightly rough, rippled texture, a bit like the roof of your mouth. That difference is the telltale sign you found it. But here's the reason most guys never feel it. They go hunting before her body's even ready. The G-spot doesn't appear until there's enough arousal. No blood flow, no texture. So if you skip warm-up, you're basically touching skin that hasn't come alive yet. It's like trying to read Braille that hasn't been printed. That's your first rule. Stop rushing. This isn't about duration for the sake of performance. It's physiology. Female arousal requires circulation. The tissues inside the vaginal wall literally engorge, same as erectile tissue. When that happens, sensitivity spikes. So the better the buildup, the more defined the G-spot becomes. That's not romance talk. That's anatomy. Now, once her body's actually awake, here's how to orient yourself. Imagine her lying back. You insert 1 or 2 fingers, palm facing up, toward her stomach. The front wall, the one closest to her belly, is where you'll find it. You don't need to go deep. 2 inches is plenty. Curl your fingertips slightly, and you'll feel that ridge I mentioned earlier. If you press toward her pubic bone, and she instinctively shifts or reacts with a low sound, congratulations. That's the area. But slow down. You're not mining for gold. The G-spot responds to gradual pressure, not stabbing motions. The right touch feels more like a lift than a poke. Gentle, steady, rhythmic. If you go in like you're trying to start a lawnmower, she'll tense up, and everything you're trying to find will vanish under muscle contraction. Here's where awareness comes in. Every woman's sensitivity is different. Some feel it clearly, others barely register it unless they're extremely aroused. So if you press, and she says she doesn't feel much, that's not failure. That's feedback. Adjust angle, adjust rhythm, or back off for a minute. The more comfortable she feels, the more responsive that tissue becomes. Here's a quick anatomy hack that most men never learn. The G-spot and clitoris are 2 access points to the same internal network. The external part you see, that little bud, is just the tip of a wishbone-shaped structure. The arms of that wishbone run inside, surrounding the vaginal canal. The G-spot is basically where the underside of that system can be reached. So when you stimulate it properly, you're lighting up the entire circuit from the inside out. That's why it can feel so intense. It's not a single nerve ending, it's a whole system firing. Now let's talk about what it actually feels like to her. When stimulated right, the G-spot can create a deep, swelling kind of pleasure. It's not sharp or superficial like clitoral touch. It's heavier, more full body. She might feel pressure in her lower abdomen or the urge to tense her muscles. Some women feel like they need to urinate. That's normal, because the urethral sponge surrounds the urethra and gets pressed. If she's relaxed, that pressure can transform into strong contractions or release sensations. If she tenses from worry, it shuts down. So reassurance matters, but it's not emotional fluff. It's about muscle control. Let's back up for a second, because this next part is the biggest misconception on the internet. You've seen diagrams with the "come here" motion. Yes, that's the right direction, toward you, not away. But it's not about fast repetition. It's about contact consistency. The best stimulation uses small movements, just enough to compress and release that tissue rhythmically. It's like tapping your thumb on a table to a slow beat. If she moves with you, great. Follow that rhythm. If she stays still, maintain steady pressure and let her body build around it. Think of it as tuning a frequency. Too fast and you lose the signal. Too shallow and you miss the nerve endings. Too deep and you're past the zone entirely. The G-spot sits forward, not down. Once you map that mental geometry, it's impossible to forget. Now here's something most men never hear. You can overstimulate it. The tissue swells with blood, and if you keep applying pressure long after peak sensitivity, it can feel sore. So if she suddenly goes from yes to wait, stop immediately. Let it settle. That pause isn't rejection. It's biology again. The body's telling you it's reached threshold. Give it a minute, and the sensitivity returns even stronger. There's also variation among women. Some have G-spots that are easily palpable. Others have less pronounced tissue. Hormones, childbirth, age, and circulation all affect prominence. That's why this is about exploration, not memorization. Don't walk in thinking every body will match a diagram. Think like an investigator, patient, observant, zero assumptions. Here's the other mistake that ruins everything: trying to multitask too soon. If you're stimulating the G-spot, keep focus there until you understand her reactions. Don't switch to external touch. Don't change positions. Don't chase noises. Every time you switch, her nervous system resets, and you lose the buildup. Once you can tell exactly how her muscles and breath respond, then you can combine stimulation. But learn the map first, before you try drawing shortcuts. Now, about that release people whisper about. Yes, G-spot stimulation can lead to fluid release for some women. It's not urine. It's a mix of fluids from the Skene's glands, which sit near the urethra. It's not mandatory. It's not proof, and it doesn't happen for everyone. What matters is sensation, not spectacle. If it happens, you stay calm. If it doesn't, you don't chase it. You're not making a movie. You're studying anatomy in real time. Let's recap the physical markers so you never forget. Front wall, 2 inches in, toward the belly. Rougher texture when aroused. Responds to steady pressure more than friction. Feels fuller and firmer with increased blood flow. Linked directly to clitoral tissue and urethral sponge. Sensitive but easily overworked. That's your field guide. Now I know some of you are wondering if this really matters or if it's overhyped. Here's the data. Research using MRI and nerve mapping confirms increased nerve density in that front wall region. Clinical studies show that stimulation there activates the same brain regions as clitoral stimulation, sometimes more intensely. So yes, it's real. But it's only accessible when her body is ready for it. You can't force find it. It's like trying to flex a muscle that's not warmed up. Nothing happens. If you're still thinking, okay, but how do I know I'm doing it right? Listen to her involuntary signals. Breathing deepens, hips tilt slightly forward, pelvic floor contracts rhythmically. Those are physical confirmations. Words are great, but biology doesn't lie. Learn to read that feedback. And now the final piece, the mindset. You don't approach this like a trick to impress her. You approach it like a skill to understand human anatomy better. When you know her structure, you stop fumbling and start paying attention. The confidence that comes from that is what makes you a better partner. Period. Not because you learned a move, but because you understand cause and effect. So, let's put it all together, step style, without making it sound like a manual. Get her arousal up first. That's non-negotiable. Know your landmarks. Front wall, 2 inches, ridge texture. Apply slow, firm, consistent pressure. Stay tuned to her body's responses. Adjust if she tenses. Don't overstimulate. That's the system. And if you want a benchmark for your own awareness, here's a challenge. Try to map that front wall with your fingers before she's aroused. Feel the smoothness. Then repeat once she's warmed up. You'll feel the difference immediately. That's the transformation you're aiming for during real intimacy. That's what you'll recognize forever, once you've felt it once. Let me leave you with this. The reason this topic confuses so many men isn't that it's complicated. It's that nobody teaches anatomy and language men actually understand. You were handed euphemisms, not maps. So now you have the map. Use it with precision, not pride. You're not proving something. You're exploring something that's been misunderstood for centuries. And yes, when you get it right, it changes how she reacts to you. But that's a byproduct, not the mission. The mission is knowledge. Accurate, practical, repeatable knowledge. So next time you hear someone joke about the G-spot being a myth, you can smile and think, you just haven't paid attention. Because once you actually learn what you're feeling for, and how her body responds when it's ready, the mystery disappears. If you found this useful, hit like, subscribe, and drop a comment. Tell me what part finally made it click for you. I'll be breaking down more anatomy and technique myths every week without the sugarcoating, because this isn't about romance or theory, it's about reality. You can't navigate a body you don't understand? Now you do. That's the point.